So here's what the New York State Constitution currently says about our physical health. Quote, the protection and promotion of the health of the inhabitants of the state are matters of public concern. And here's what our Constitution says about mental health. Quote, the protection of the mental health of the inhabitants of the state may be provided by state and local authorities, suggesting, of course, that it also may not. This long overdue amendment, the current language of the Constitution dates from 1938, creates parity between physical and mental health, and in doing so both recognizes the importance of mental health as a matter of public concern, and it provides a constitutional commitment to support families and individuals who need to access mental or behavioral health services and treatment. I imagine that after the year that we have just lived through, that there isn't a person in our state who doesn't have a greater understanding of mental health. All of us have personally experienced or know someone who has experienced depression, anxiety, stress, despair, fear, loss and loneliness, and more. Maybe new and unrecognizable feelings that you just can't label. Some of us self-medicated by disordered eating or substance abuse. Some of us perhaps spent more time in nature. Others found their existing mental health conditions exacerbated or challenged by limited access to therapists, frustration with remote telemedicine, and maybe triggering feelings of isolation by having to have AA or NA meetings on Zoom. Let's be clear. The need for this amendment well predates the COVID-19 pandemic. As chair of the Assembly Committee on Veterans Affairs, I am acutely aware of the devastating statistics around veteran suicides, still around 17 a day, as well as the effects of trauma, including PTSD, military sexual trauma, and other emotional and psychological impacts of the military experience. Alarmingly, suicide has reached crisis proportion in other diverse populations across our state as well, from rural farmers to young people, most strikingly Latina girls. In 2017, suicide attempts by Hispanic girls grades 9 through 12 were 40% higher than for non-Hispanic white girls of the same ages. According to Mental Health America, suicide is the 10th leading cause of death in the United States, accounting for more than 1% of all deaths, and it's the second leading cause of death among people 15 to 24. For a number of years, at every visit to a school in my assembly district, at least one teacher or building principal has shared with me that mental health is the number one issue they're dealing with at their school, no matter what age student they are working with, and that they don't have the knowledge and the training or the resources in the school to address it. Mental health problems are a leading health challenge for children. Half of all lifetime cases of mental illness begins by age 14. And 3/4 begin by age 24. I was troubled to learn that in our country, most people don't enter care for their mental health issues until 9 years after their problems first appear. I have been proud to sponsor this constitutional amendment for the past few years, and I thank Senator Reichlin-Melnick for introducing this bill in the Senate. This amendment is a powerful step in reducing stigma and discrimination, which are amongst the key barriers to effective mental health care. Now is the time to ensure parity between mental and physical health in the great state of New York. Thank you very much, and it's my pleasure to introduce my Senate colleague.
Thank you so much, Assemblywoman. I am Senator Elijah Reichlin-Melnick, and it is a pleasure to be here to support this very needed legislation. We're here to address a major problem with a very simple solution. For far too long in the state of New York, there have been two different systems, two different schools of thought, a structure of separate but equal, so to speak, treatments that create a stigma around mental health, and it has very real impacts on the way that mental health care is administered in our state. Our bill, S3995 and A5238, will ensure parity between mental and physical health in the New York State Constitution, guaranteeing New Yorkers that mental health care is health care. For years, cuts have been made to mental health services to help balance the budget in New York. This year, Governor Cuomo proposed closing down the Rockland Children's Psychiatric Center as a cost savings measure. This would have meant that the children and families of the lower Hudson Valley that need life-saving mental health treatment would have had to travel hours away from their home to a facility in the Bronx or out to Utica. Thankfully, with the support of my colleagues and thousands of activists around Rockland County and the Hudson Valley, the 2021 and 22 New York State budget rejected those cuts, and Rockland Children's Psychiatric Center remained open to serve the most vulnerable residents of our communities. However, while this facility was kept open, the number of beds for inpatient services at other facilities across New York faced cuts. In the middle of a pandemic, when extended isolation and fear have created a mental health crisis, we have to change our paradigm. It's no longer acceptable to consider mental health as secondary to physical health. No longer can we let mental health issues be dismissed as personal failures or as temporary feelings that a person should overcome on their own. We need to make sure that New Yorkers know that mental health care is health care, that there is nothing wrong with needing help, that we, as the leaders of the state of New York, stand with mental health organizations and mental health care providers. Our bill will make sure that it is part of the defining laws of New York, part of our Constitution, a constitutional right of all New Yorkers, that their health care is not limited just to their physical health, but that their mental well-being is just as important. I'm proud to partner with Assemblymember Didi Barrett, who has been leading on these issues for years, to introduce this legislation, and I look forward to the day when we can all say that mental health care is health care. And we know that the Constitution of the state of New York will back us up. Thank you for being here, and I'm happy to introduce my colleague, Senator John Mannion, the chair of the Committee on Disabilities.
Good afternoon. I'm Senator John Mannion. I've come from Syracuse, New York, and I'm proud to be here today to support Assemblymember Barrett and Senator Reichlin-Melnick in their efforts to get things right. We all know that mental health is part of your physical well-being. Mental health is your health, but it's clearly not viewed or treated that way, and mental health does not get the same level of funding as other healthcare sectors. What the Senator and the Assemblywoman are proposing is a simple change to the state constitution that will bring parity to the mental health field. We've seen the enormous toll that COVID-19 has taken over the course of the past year or so. Addiction, suicide, including among some of our youngest, continue to be on the rise. Imagine if we prevented just one mass shooting that we so often and tragically see in the media. Imagine if we prevented the next suicide. Imagine if we prevented the next opioid addiction. And there is good news. We've already done that, and that's due to the good work of the people who provide the care and those that have also struggled and have been overly transparent in those struggles to help others. That's a lot of ifs. What if we could do all of those things? And the answer to all of them begins with mental health parity. I thank you for having me here today and for championing this legislation, and I proudly, as the chair of the Disabilities Committee, stand in support of this absolutely necessary and important change. It is my honor to introduce Glenn Liebman, CEO of Mental Health Associates of New York.
Thank you very much for this opportunity. I just want to thank the leadership. Thank you very much for your leadership. It's greatly appreciated. We thank you so much. So my name is Glenn Liebman. I'm the director of the Mental Health Association in New York State. We're comprised of 26 affiliates in 52 counties throughout New York State. And we're really pleased to be here today because we often talk and fight on the stigma. And that's why we're so supportive of this legislation, because the bottom line is our Constitution is the most important document we have in New York State. It's our state constitution. And for our state constitution to sit there and to say that mental health services are not a right, that makes no sense whatsoever. And we are very upset about it. And that's why we're so pleased that this legislation is out there. And if it, as Assemblymember Barrett said, we are sitting here in a pandemic. We have spent the last 13 months with two crises. We've had the crisis that we're all very familiar with, the over 500,000 people who've passed away, but there's also the mental health crisis. There's the anxiety, there's the depression, there's the isolation, there's the grief, there's the substance use. There is all kinds of, issues that have occurred because of this. And yet we're not recognizing that mental health is as significant as physical health care. It makes no sense whatsoever. And the fact is that we know that people are suffering. We know that people have suffered during the pandemic. We know, we're talking about the suicide numbers. Between now, the ages of 16 to 24 during the pandemic, 25% of those population have seriously considered suicide. So we know what this is. And it's not just the pandemic, it's what's been going on for years and years. And thankfully, because of leadership in New York State, we're going to fight this. We're going to end this travesty. And mental health is going to continue to be part of what our Constitution is, and we're going to have the same rights as physical health care. So I thank you all very much for this opportunity.
It's my great pleasure to introduce Jim McDonough, who I had the pleasure of working with when he was the head of the director of the Division of Veterans Services, and he'll tell you more about his work now.
Thank you, Assemblymember Barrett, and good afternoon. Jurist Louis Brandeis described states as laboratories of democracy, and today we see New York State's laboratory in motion, working to amend our state constitution to create parity between mental and physical health. No citizen of this state should continue to suffer the disparity between mental and physical health. As a veteran leading a national-facing mental health treatment practice for military-connected families, I see every day the scourge of stigma and barriers to care associated with mental health. And I applaud the efforts today of the New York State Senate and the New York State Assembly and its leaders to introduce this amendment to our Constitution. Thank you very much.
And we'll now hear from Matt Shapiro, Associate Director of Public Affairs at NAMI, New York State.
Thank you so much, Senator. It's really a pleasure to be here today, and I want to echo Glenn's sentiment and our gratitude both to you and to Assemblywoman Barrett for being so steadfast on this important issue. And it's so exciting to have new members of the Senate really fighting for mental health, because this fight has never been more important. As Glenn said, we all know the terrible negative impacts that the past year have had on our collective mental health. And we have seen a need for mental health services in unprecedented levels, and we need to make sure that the services are there to meet that demand. And that starts by recognizing the very simple fact that one can simply not have physical health without mental health. It's, like everyone says, such a simple realization, but one that is been very difficult to advance here in New York State. And as was said, our Constitution is our foundation, and now we have an opportunity to rebuild that foundation and build on top of that, so the people that have been impacted by mental health care or mental health challenges will get the services they need, and make sure that those services are covered. Because, as we said, as we've been saying throughout the pandemic, New York simply cannot recover or even think about moving forward from the events of the past year without addressing mental health. So we're so grateful for this opportunity to talk about this and to hopefully get this in our state constitution and move forward to a healthier and more balanced, complete, healthy New York State. So thank you so much.
It's my great pleasure now to introduce Joan Hunt, the director of the Greater Hudson Promise neighborhood, my constituent and an advocate for mental health on multiple different fronts.
Thank you, Assemblywoman Barrett. It's an honor to be here and support this legislation. From where I sit and working with children and families in the Hudson community from cradle to career, I see an immense stigma, particularly within communities of color as it pertains to mental health, and a vast disparity between how mental health services are viewed in different communities. Particularly in my work with children and families impacted by the criminal justice system, There is so much trauma involved in that experience for so many families. 1 in 28 children in America are impacted by parental incarceration, and so many more by adverse childhood experiences in their very early years. So I see this opportunity as one that really brings a level of a different awareness to communities and destigmatizes the need for mental health services and mental health supports. And I think to some this may seem like a language change, right? But I think language is so important, and it really drives the way we think about those that we serve and those in our community. So I just want to leave you all with a quote from Carl Albrecht that says, "Change your language and you change your thoughts." So hopefully this is a huge shift in our state in how mental health services are viewed and more access is available to our communities. Thank you.
Thank you so much. And next, we're going to hear from Maggie Traynor, the Director of Residential Services at the Mental Health Association of Rockland. Thank you so much for being here.
Thank you for asking me to join. I'm happy to represent the Mental Health Association of Rockland, and we absolutely support this change in the legislation, and we're very grateful to the Senate and the Assembly for taking this on. It's time, and it's long overdue. The impact that this could have on people, particularly people who are financially poor, to be able to have choice and access and not be limited to a few weeks of an hour here or there for mental health services. It should be considered equal with the health services in New York State. New York State, in January, I guess, when the vaccine became available, New York State, for the first time in my many years in working in mental health in New York, we were considered 1A, if you recall, to get the vaccine. So for the first time ever, I realized we are finally considered healthcare workers and not just mental health workers. So I do appreciate it, and I hope that it will definitely address the amount of stigma attached to the reality of mental illness. Thank you.
Our final speaker is Claire Pardee, Executive Director of the Healthcare Consortium in Columbia and Greene Counties. Thank you.
Hello. I'm so grateful to Assemblymember Didi Barrett and Senator Elijah Reichlin-Melnick for allowing me to add my voice to those of my esteemed colleagues in support of efforts to create parity between mental and physical health in New York State. Our rural health network includes multiple health and human service providers, all of whom I feel confident in saying recognize that there can be no health without mental health and well-being. Time and again, we see people in our community who, as a result of poor mental health, are not able to care for their physical health, and indeed their physical health deteriorates, diminishing their lives and consuming vast healthcare resources. A lack of mental wellness, then, makes a direct contribution to poor physical health, all at great cost to the individual, to the family, and the community as a whole. It is high time that our state policies stop minimizing mental health and start enabling the mental health services and supports that have been so marginalized and under-resourced. The effort described here today takes an important step in that direction. I'm glad to see it happening and lend my enthusiastic and even passionate support. Thank you so much for your time.
Thank you so much, Claire. Thank you to everybody that's joined us here today. At this point, if there are any questions for me, for the Assembly member, or for others here, happy to take them. Yes. So I'll start at the beginning, this is a constitutional amendment, and so New York's Constitution to amend requires that an amendment be passed by 2 successive state legislatures. So our hope is that we pass it this year, and then we would need to come back and pass it after the next election in 2023, and then it goes to voters for a vote. So unfortunately, we're going to do it as quickly as possible, but by its nature to amend the Constitution, it doesn't happen as quickly as a bill. And I think what parity means is as a constitutional right, actions then flow out of that, and the actions of our state regulators, the actions, we hope, of insurers and of other individuals out there flow from the fact that right now, according to our state constitution, health is protected, mental health is left unmentioned. And as the Assembly member said, and I'll let her speak to that, it just says that local governments may protect mental health, not that they must. And so we think that if there is a situation where they must protect it, then if there is a local government out there, if there's a county or any other organization that isn't protecting it, that gives rights and it gives options to people who feel their rights have been violated. So I'll leave it there.
Thank you. I would just add that I think this is, and you heard from our wonderful speakers here, an opportunity to elevate this issue to where it really is in our hearts and minds, but not in our Constitution, and ensure that when you're addressing treatment options and somebody says, oh, well, we'll take care of your physical wounds, but I know the trauma that you felt can't be addressed at this point in time because we just don't have the money for it, or we're not prepared to do that. So I think that the opportunity to really look, and hopefully we'll take this year and a half until after we pass it here and get it passed again, to start that education process and really help inform the kinds of changes that we want to see in our communities and in our service providers and in our local governments. So, thank you.
Other questions? Okay, thank you all for being here, and thank you everybody for joining us.
Thank you. Thank you.